Are you aware that medication error is a worldwide issue? Do you know there are around 2,300,000 of medications-related incidents happened in Australia last year? Hi, my name is Lam. This presentation is going to talk about a contemporary nursing practice, which is medication error in healthcare environment. This is an issue related to patient safety and healthy workplace. Overview. In this presentation, I will discuss this issue by using a problem-solving sequence. So I will begin with why medication is a problem related to patient safety and healthy workplace, and why is it significant to discuss this issue. Then I will move on to discuss what is currently being done to resolve this problem. Finally, I will be mentioning what kind of leadership style and techniques could help to resolve this high prevalence incident. This presentation will be critically reflecting from a leadership perspective, as we will soon becoming a new graduate RN and empower ourselves as a leader in the clinical floor. That is a lot of nursing techniques and management skills could adapt into our practice. We should also take legal and ethical boundaries into account because it is part of our nursing standard. Okay, so let's get started. Why medication error is a problem related to patient safety and healthy workplace. As we all know, medication administration is a daily nursing practice. Each hospitalized patient will have at least one medication within the admissions, according to Rathak, Sempel, and Rosenfield in 2016. Medication error is a problem related to patient safety because imagine if a wrong dosage of medications or inadequate amount has been given to the patient, it could cause us harm, increase the length of stay of the patient, and slow down the recovery process. Seriously, it could be fatal. In a systematic review done by Rathak, Sempel, and Rosenfield in 2016, they found out that an observational study done by Westbrook and the other authors, they found out that approximately 80% of medication error has been observed during the administration stage. Okay, now you must be questioning, so how does this relate to healthy workplace? Often, we thought medication error is solely on human factors. Example like calculation of a wrong dosage of drugs resulting in an adverse event according to Clinical Excellence Commission in 2015. However, it is also referring to a system factors which is created an unsafe and unhealthy workplace. The following example is extracted from different peer-reviewed articles, such as it could be nursing staff is mentoring nursing students and delay the consummate time for drug administrations, according to Blinknock and the other authors in 2017. Or nurses is busy with multiple tasks. But why is it significant to discuss this issue? Because within the observational studies done by Westbrook and the other authors cited in Rathak, Sempel, and Rosenfield, 74% of unsafe practice are not reported. These unsafe practices compromise and place patient safety and healthy workplace to a further risk and create a disgraceful working environment. Performed mistakes could be detrimentally stressful and affects the healthcare providers psychologically. But if we do not disclose and talk about this sensitive issue, it is not only violated the nursing professional standard. Number 3, maintains the capability for practice. Standard 6, provides safe, appropriate, and responsive qualitative nursing practice. And number 7, evaluates outcome to inform nursing practice. But also, it is also violated the Code of Conduct, Principle 1.2, 1.3, lawful behavior and mandatory reporting, nursing practice and adverse events and open disclosure, according to the Nursing and Midwifery Board of Australia in 2018. So, what can we do to prevent and resolve this problem? We will first look into what has currently been done about this problem, then move on to use a new graduate nursing perspective and a team leader perspective to resolve this issue. In New South Wales Health, medication chart has been systemized and moved from paper-based system to electronic system to prevent human error mistakes. This is according to Australian Commission of Safety and Quality in Healthcare in 2017. Second, clinical procedure role safety policy created by New South Wales Health, allowing all nursing manager, registered nurse, and endorsed enrolled nurse to follow guidelines when medication procedures are unclear. This is according to Clinical Excellence Commission 2017. Number 3. The Clinical Excellence Commission has also launched a medication safety self-assessment for Australian hospitals in 2015. It helps registered nurses to self-reflect and review the medication safety process by completing a workbook. This workbook consists of 302 questions, which is extremely detailed assessment to guide nurses to accomplish a medication safety goals. And number 4, continuously professional development, such as in-services created by New South Wales Health and online module from My Health Hattie to ensure medication safety. But system and guidelines are always not good enough. Therefore, it is recommended by the Australian Commission of Safety and Quality in Healthcare 2017 that, except of implementation of the system, leadership is extremely important to address this issue. It is also being proved from 4 of the studies that transformational leadership, trust, an experienced manager or educator support could help to reduce the rates of medication error and improve the quality of healthcare. As a new graduate nurse, what is our responsibility to prevent and resolve medication error? Because research shows that the highest risk of performing a medication error are new graduate nurse, according to Roth-Hexenpel and Rothwell in 2016. Therefore, to prevent medication error, new graduate nurse should practice within our scope of practice. Do not perform any practice before any accreditations. Always provide feedbacks and report near misses to the manager and create a healthy working environment. This allows leaders to reflect what can be done to prevent a serious adverse event happened, according to Basmoradi and the other authors in 2016. Also, bravely speak up, because when unreported medication error has happened, it is always good for the leader to guide us with all the available support. Effective leadership represented the role model in the clinical flow, which means this manager or educator must perform legal and ethically safe healthcare procedure. Ideally, leaders in the clinical flow should have these 4 transformational leadership elements to ensure nursing staff is fully educated and systematically bound to prevent error. I will call it the 4 I's. They include idealized influence, inspirational motivation, intellectual stimulation, and individualized consideration. Idealized influence represents a role model on the clinical floor, which is really similar as a YouTube influencer, but in a healthcare system, which influence all the other nurses to stay in a professionalism, set out expectation, and do not violate the code of conduct, ethics, and maintain a high nursing standard. Inspirational motivation represents to inspire nurses to a higher standard by providing challenging simulation during the in-services. This could motivate and allow nurses to recognize medication error by overcoming obstacles. Intellectual stimulation represents by recalling how mistakes happened and learn through mistakes. This is similar as a feedback section. This allowed nurses to stimulate their problem-solving skills to ensure they recognize the unsafe practice. Finally, the individualized consideration represents leaders should be considerate and provide directional support when errors or mistakes happened. So this is an example of a hotline in Australia. which is from the West Sydney Local Health District. Hopefully, all these recommendations could help build a safe clinical environment, bring patient safety and healthy workplace together to optimize the patients' and nurses' quality of life. Thank you. So this is my reference list.